Kia ora, I'm Amanda Gillies, and on the detail today, smoking, illegal tobacco and vaping. In 2025, are any of these going up in smoke, or is our country's love still burning strong?
The evidence suggests that we're not heading down in the right direction fast enough, and so I think we've got more work to be done in 26 and beyond.
Personal question for you, Chris. Have you ever smoked or vaped?
I did smoke as a teenager. I have only vaped for research purposes.
Is that what you tell Mum and Dad?
That's right.
That's Professor of Public Health Chris Bullen from Auckland University. Today we'll discuss where we are at with Smokefree 2025. The goal was to have fewer than 5% of all Kiwis smoking by the end of this year, across all population groups.
82,000 people would have to quit smoking by the end of the year in order to meet the goal of Smokefree 2025.
Realistically, are we going to make our target?
I don't believe so, sadly.
So what's gone wrong along the way? And are the smoke-free regulations driving desperate smokers to illegal deals?
Illicit tobacco sales, booming business. Organised crime groups are using things like Facebook Marketplace to sell. We know this because we've got new research this morning from the tobacco industry that now claims as much as a quarter of all cigarettes in this country are sourced illegally.
Just how much cheaper are these illegal cigarettes?
At least half price.
And has vaping been the solution we hoped for, or just a replacement addiction for our young people?
Almost half of schools across New Zealand have a vape store within walking distance, despite recent legislation aimed at preventing this.
I think we need to get tougher on the vast number of vape stores that we have. They're just way too accessible here in New Zealand. We've got over 6,500, which exceeds the number of schools.
Don't forget, it's illegal for under 18s to vape, but where there's a will, there's a way.
For 10 and 11-year-olds, probably those kids who are vaping are getting them from their siblings or from friends in the school ground who are operating like drug dealers, if you like, the distributors.
More on vaping in a moment, but first, cigarette smoking. Today, some 300,000 Kiwis are still daily smokers. And while I don't smoke, it's easy to see how people can get addicted.
Cigarettes are a beautifully engineered consumer product that have taken decades of precision engineering to deliver nicotine into the bloodstream as quickly and efficiently as possible.
It's that hit which is hard to give up, and perhaps why the highly publicised Smokefree New Zealand 2025 goal won't be reached. Launched 14 years ago, the goal's been backed by successive governments, with tweaks and updates along the way.
The government's announced radical moves to get the country closer to reaching the Smokefree 2025 goal. Among the raft of proposed new rules announced yesterday was a rising age prohibition, meaning no one aged 14 or under will ever be legally able to buy cigarettes. Only products with lower nicotine levels will be allowed to be sold to make cigarettes less addictive, and they'll be for sale in fewer places.
That was 2021 under Labour. This is 2024 under the coalition government.
Last year, the coalition government repealed 3 areas of smoke-free law, including denicotinisation of tobacco products and banning the sale of tobacco products to those born after January 1st, 2009.
So I asked Chris Bullen, what impact have the latest changes by the government had on the smoke-free goal?
I think we could have got there under the previous legislation that was repealed by the current government. The lack of policies to support and motivate more people to think about quitting means that there's an awful lot of effort on the ground that's got to go on to get 85,000 people to quit smoking between now and the end of the year, and I just don't see it happening fast enough.
And interestingly, I read that the number of smokers went up last year. Is that correct? And if so, what do you think's driving that?
Yeah, well, it could be a little bit of just the variation from that you get with survey to survey. I think the take-home message is that it hasn't gone down as it has done year on year for, 20 years. So this is the first year in a long time, or between 2 years, where the numbers hadn't changed, at least they're stable or maybe gone up a smidgen. And that's a concern because it suggests that what has been working is no longer effective.
So what would you like done? What should be done to get us back on track?
I think we need to revisit the denicotinization strategy.
That's where the nicotine is basically taken out of cigarettes. It's a reduction of about 90%.
Get that back on the agenda again. And we have to also look at the opportunity to think about locking in smoking as being non-normal for all young people through some kind of smoke-free generation approach, such as we proposed in that original legislation, but which was repealed. The UK seems to be interested in it.
Smoking is the UK's single biggest preventable killer. It is responsible for around 80,000 deaths in the UK each year. It kills 2 out of 3 long-term smokers. That's why we're taking steps to protect our children from ever getting addicted to smoking.
Other countries have picked up the baton from New Zealand when we dropped it. So I think that would lock in the very low levels of smoking in our young people forever, which would be a real boost for their future prospects.
I get, Chris, that it's hard for people to give up smoking. I get the addiction. But what on earth possesses someone to start smoking, do you think, in 2025?
Great question. I don't think there's much in it for most people. You know, what we're seeing is extremely low levels of smoking amongst young people. They're using other things like vapes and now oral nicotine products coming into the marketplace illegally, but they're still out there. In slightly older young people, smoking's a little bit higher, but still very low historically. I don't think that many adults would really be interested. The problem is the price is so high and it's so sort of socially unpopular. So there's all sorts of pressures on people, good reasons for them not to start smoking. The only thing I can think of is that there's a change in what's regarded as being cool from, influencers and so forth.
Because my generation has decided to make cigarettes trendy again.
You what?
And it seems like cigarettes are now coming back into style.
Somehow smoking returns.
Cigarettes are having a renaissance, and Gen Z is driving it. And I blame celebrities, because there are so many younger celebrities, younger influencers that are out in public smoking cigarettes in front of paparazzi, posting them on their Instagram story, kind of like a cool aesthetic thing, which has just got to be an awful influence on all the younger people looking up to them, because obviously these celebrities are idolized.
Which could potentially turn things around, but for all the other reasons, the financial reasons and the health reasons that people are well informed about, I just don't think it's likely to be a big issue. But we do need to monitor what's going on, because things can change, as we know, very quickly.
How much is it nowadays for a packet of cigarettes?
Between about $35 and $45 for 20 cigarettes. It's extremely expensive. One of the people I was speaking to today, who was requesting help to quit smoking, was confessing to accessing cheaper cigarettes from a dairy in the Central Business District. So there is a bit of black market discounting going on, which is something that the government needs to be more active in.
Here's a stat for you. What about this? 25% of cigarettes sold in New Zealand are from the black market. 25%. And they're being smuggled into the country, and crims are making millions selling them on Facebook Marketplace, selling them at construction sites all over the place. And let's be real, you probably don't have to go too far to find a dairy selling them either.
The tobacco industry has just put out a stat to say that 25% of cigarettes smoked are illegal. Is this true? Are 25% of Kiwis smoking illegal tobacco?
I don't believe the proportion is as high as is claimed by this report, which was funded, as you said, by the tobacco industry.
He believes the industry inflates the number and the problem to encourage the government to ease up on being tough on their tobacco.
So that's consistent with their modus operandi. What we've found in independent assessments, which are much more thorough than the ones commissioned by the tobacco industry, suggest it's much more likely to be lower than 10%, 1 in 10, 1 in 12, 1 in 15 cigarettes smoked in New Zealand are obtained by illicit means, either homegrown tobacco or most likely smuggled tobacco.
What are the risks, Chris, of sort of buying or growing your own illegal tobacco? I mean, do you know what you're getting?
Well, whatever kind of tobacco it is, it's really dangerous. So I think whether it's homegrown, or which is pretty hard for people who've been inhaling conventional, manufactured cigarettes, which have got all sorts of additives to make them very easy to inhale compared to rough, harsh, homegrown tobacco. So I think it's relatively easy to get a hold of because it's advertised quite widely on Facebook Marketplace and in community markets and in people's windows and so forth. And it's a lot cheaper. But the risks are not so much health risks, although obviously maintaining your smoking addiction is not great for your health. The sooner you can quit, the better. But there's risks if you get caught out supplying or selling the stuff, huge fines. And then there are the risks basically to the whole tobacco control enterprise. In other words, the government's efforts and expenditure on trying to help people to quit smoking and stop people from starting are really going down the drain if we've got a big black market in tobacco in New Zealand.
Just how much cheaper are these illegal cigarettes compared to your standard, tobacco company ones?
At least half price.
Wow.
So the woman I was talking to today was able to get a pack of 20 cigarettes. She didn't particularly like the brand, but they were cheap, so she got them, and they were about $20.
What's the difference in taste between a legal and illegal cigarette?
Well, it depends on many things because the illegal cigarettes are often almost identical to standard cigarettes, but people have brand, affiliations. They like the flavour of Rothmans compared to Double Happiness, which is a big Chinese brand, for example. Manufacturers add all sorts of additives, sugar, various flavourings and other chemicals to make them easier to smoke and potentially more addictive as well. That might enhance the action of nicotine. And so everybody's got particular preferences. And that also cigarettes contain different amounts of nicotine. We never know exactly in New Zealand how much nicotine, but we have historically had quite high levels of nicotine in our cigarettes compared to some other countries. And the tobacco industry's got free rein to put pretty much whatever it likes in these products. So I think, the sooner we can control tobacco, the better. And then we've just got these other issues to work on. It's a bit like whack-a-mole, you kind of get on top of one thing and something else pops up.
When it comes to illegal tobacco, most of it is coming from Asian countries, largely China or South Korea. Chris Bullen says some dairies here aren't selling it just by the packet, but also as single cigarettes.
The fines for selling these products need to be stepped up so that it really is a real disincentive to try and even think about selling cigarettes cut price or single cigarettes, which is another avenue to make smoking cheaper, is to sell single cigarettes, which some dairies have been found doing. Makes them more attractive to children and young people, of course, because the price point's much lower for a single cigarette.
So they sell just one cigarette?
Mm-hmm.
What do you pay for that?
Well, you might pay, $1 or something. I mean, effectively, in a pack, you're paying $2 per cigarette with the full legal packs. But by selling singles, then the threshold to actually attain a cigarette is very low compared to a full pack. You can't legally sell anything less than a 20-pack cigarette in New Zealand. So breaching that is illegal, and if you get caught out, such as people do from time to time, and the government's increased the number of smoke-free enforcement officers doing both illegal vape sales to under 18-year-olds as well as single cigarette sales or sales of cigarettes of any kind to minors.
And I want to talk about vaping because it's a habit increasingly adopted by Kiwi teens. It's just been revealed that almost half of schools across the country have a specialist vape store within a 10-minute walk, despite recent legislation aimed at preventing this.
Auckland University research shows 44% of schools have one within a kilometre. In 2023, the government passed a law banning specialist vape stores from opening within 300 metres of schools, but existing shops were allowed to continue operating.
The problem we've got is that we have now got regulations to stop new specialist vaping stores starting within 300 metres of a school, early childhood centre or marae, but existing ones are still able to operate, And then we have a number of other outlets like petrol stations, many dairies, supermarkets, which can sell a limited range of vapes. They're general vaping retailers, and they can be over the road or next door. There's no legislation to restrict their access or visibility to kids on the way to and from school. And we know that association with visibility is important in normalising or making these products more acceptable. There is a new piece of legislation that's kicking in the next month, which will limit the visibility of advertising and products in the windows of vape stores. So that's a good move, but it's taken a while to get there. But this loophole remains where existing stores and general stores can still be very close to schools and on the journey to school for children. I just don't think it's good enough. I think we need to get tougher on the vast number of vape stores that we have. They're just way too accessible here in New Zealand.
So what could the government do on this then?
Well, I think we should continue to demand that the government restricts the general vaping retailers. I don't think we need as many. We've got over 6,500 vaping retailers in New Zealand, which exceeds the number of schools. And, accessibility for people who smoke and want to use vapes as a way off smoking is great, but we're just awash with vape stores in some of the poorest suburbs. Quite high proportions of these stores are still selling to children under the age of 18 illegally.
How young? How young are our kids when they start vaping?
Yeah, that's a really good question. We don't have any regular surveys of very young children. The youngest regular survey we have, which you can track vaping, is the annual ASH Year 10 survey of 14 and 15-year-olds in Year 10. And that suggests that vaping might probably just starting to come around and decline, but it's still very high, particularly for Māori and less so for Pacific, but also for European young people. For 10 and 11-year-olds, probably those kids who are vaping are getting them from their siblings, like many of the teenagers, or from friends in the school ground who are operating like drug dealers, if you like, distributors. And they've probably got a favourite store or getting on the internet where you can just click a box which says I'm 18 or over, and bingo, you've got a delivery on its way if you can hide that from your parents.
As we joked earlier, Chris also hid his vaping from his mum and dad, but in all seriousness, he says it does help his research.
It's often useful to become familiar with how they work. So I've got quite a collection of vapes from the first ones that came into the country and the contemporary versions. They've changed a lot over the years, and they've just become much easier to use from the get-go and less likely to leak. And the batteries last longer, and they're much smaller, and have lots of nice flavours. So they're really a very different product to what they were when we first started looking at them back in 2010-11, and found them to be, not bad as a kind of nicotine delivery tool, with the idea of them being therapeutically useful for people who want to quit smoking. But the game's changed a lot since then.
But Chris, what are the sort of short-term and also the long-term side effects of vaping, the sort of serious stuff we're talking here?
Yeah, so most people who vape do find they get a dry throat and a bit of a cough, but tends to settle down over time. That's what most people experience. There is a likelihood that inhaling a product multiple times a day for many years, whatever you're inhaling, is not good for your lungs. So my message to people who are vaping is, use it only if you've been smoking as a way of getting off cigarettes, and then seriously give thought to getting off the vapes as soon as you possibly can. They're definitely less harmful than smoking, but they're not harmless. And so they're kind of a step down from the incredible harm from smoking. And, there's debate about exactly how much less harmful they are, but nevertheless, I think most people would acknowledge that the science is pointing them to be substantially less harmful than smoking. Nevertheless, they are not without harm. So the message is, if you've been a smoker and you've used vapes to help you quit smoking, get smart and get support to help you quit vaping and get off them and breathe fresh air.
Gosh, do we know if there's been any deaths related to vaping in New Zealand or even internationally?
There have been some deaths related to vaping. The main flurry of concern was around a condition called EVALI, which is e-cigarette or vape-linked acute lung injury. And that was initially reported in the United States when some keen people determined to make a fast buck tried to mix cannabis oil with and put them into vapes, and they used vitamin E acetate as a chemical to sort of make that easier to create the vapor. And that's a direct lung toxin. And so a number of people died. Some people were in ICU, etc. So that was a kind of an outbreak. Every now and then we hear reports of people getting other sorts of serious lung problems. To my knowledge, no one has died in New Zealand from vape directly related to vaping. However, I think there have been some deaths of children who have drunk the e-liquid, the vaping fluid from a container. It's used to fill the reservoir type of vapes. And then some vapes have, because they're battery-operated devices, have had a problem with overheating and exploding, just like any other electronic battery-operated device can. And because there's millions and millions of them, yes, it's always possible that some will be faulty or overheat. And so people have suffered some serious injuries from those problems. As far as other causes like, cancer, heart disease, etc., it's really hard to pin down and get consistent evidence that's compelling to say these are as bad as cigarettes or almost as bad as cigarettes. So we just have to wait for that body of evidence to get more substantial. And it's quite tricky to do that kind of research. It's not as clear-cut as you might think.
For Chris, the act of vaping isn't an enjoyable work experience. In fact, it can make him feel ill.
I didn't enjoy it. I think if someone isn't used to inhaling nicotine through a vape, it's almost as good as smoking in terms of getting nicotine to your brain. So I did feel a bit queasy, and I didn't like that feeling. I get seasick very easily, so it was quite aversive, regardless of the flavour. And I got a bit of an irritation in my throat. So personally, I didn't feel it was great. I think for someone who's smoked for many years, it probably feel quite okay. They're kind of used to the irritation and the dryness and the kick in the back of their throat. In fact, that can sometimes be part of the whole love affair with smoking that can pass through to vaping. So there is a bit of a learning curve, I think, but once nicotine starts to hit in, people rapidly find it hard to quit either cigarettes or vapes.
That's all for today. The Detail is a newsroom production supported by RNZ and New Zealand On Air. Thank you to Chris Bullen. This episode was produced by Gwen McClure and engineered by Jeremy Ansell. I'm Amanda Gillies. Mā te wā.